People before profit have been unique, clear and consistent in arguing that we need to deal with COVID-19, a strategy to eliminate community transmission so we can avoid a constant cycle of going in and out of one lockdown after another, which is what we believe your strategy is inevitably going to result in. We think you are wrong to ignore critical parts of the advice given by the public health experts in their letter of November the 26th, and we think in rejecting some of their key advice, particularly around the reopening of the hospitality sector, you in fact are endangering Christmas itself and risking the family gatherings, which is what most people want to protect. But if we disagree on these things, and we do, and indeed I hope we are wrong about where this strategy of yours will lead us, one thing is absolutely clear from the public health advice and the letter of the 26th of November, and that is their caution about the strategy you're pursuing and some of the decisions you've made is related to the ability and capacity of our health service to cope with further outbreaks, further waves, and particularly the resourcing and staffing of our public health teams. And it seems to me about that there is absolutely no dispute. And I think in that regard, you are singularly failing. Not just do I think you are wrong and do we think you are wrong in the strategy you are pursuing, but that you are failing to provide the resourcing, the support, the staffing that is necessary for our public health teams and for our health services generally to be able to deal with further infections, with further waves, with further outbreaks. Our public health teams, who you are praising and applauding, are going on strike in January. The people who are on the front line. If we're going to deliver an immunisation programme, we are going to do so with public health teams that are 1/3 of the recommended level of staffing, and where we have treated them as second-class citizens in terms of their status as medical specialists. We have recruited contact tracers and testers who we need to deal with the outbreaks on the worst temporary agency contracts where they don't even get sick pay and they are essentially in a hire-em and fire-em position. Not exactly the way to implement what the public health experts are saying is a much greater capacity, integration and cohesion in our public health teams to deal with COVID-19. And then finally, the utterly disgraceful treatment of thousands of student nurses and midwives who, because of the high level of infections in our hospitals, which NEFID also expressed deep concern about, who you have removed payment for, and who are actually working on the front line with no payment whatsoever. So at the very least, Taoiseach, will you accede to the demands of the public health doctors? Will you put the contact tracers and testers on decent contracts, pay and conditions? And will you pay the student nurses and midwives something instead of exploiting them and paying nothing when they are working on the front line for all of us?
Over time, please, Taoiseach.
Yeah, could I first of all say the Deputy, in my view, is wrong in his various assertions. In the first instance, I don't believe in the Deputy Zero COVID approach. I don't think it's viable with the fact that we share, in terms of our membership of the European Union, our relationship with the United Kingdom, and the seamless interaction of peoples there, but also the border north-south. We're not in charge of the jurisdiction public health-wise in Northern Ireland. We've seen how there has been overlap and impact there in terms of the COVID issue. And also, the bottom line is, in terms of Wave 2, we're one of the best performing countries in Europe. The strategy that has been pursued has worked so far. It's not in and out of lockdown. We've had 2 very severe restriction phases now since COVID broke out. The very first one, as you know, in the springtime, and that was a very severe form. The second one, most recently ended, was less severe because we kept the schools open. And contrary to what you're saying, we kept the health service open, unlike the first phase. Because in the second phase, the non-COVID health services were kept open. And the second phase did not have anywhere near the same impact on hospitalisations, mortality or ICU occupancy as the first phase did. And the evidence from a variety of sources, from CSO, Central Statistics Office, from NEFIT, and from other reports that we received, confirm all of that. It's been a different wave, the second wave. We've had one of the best performance, globally in relation to mortality in the second wave, through the various measures that we've introduced. That said, there can be no room for complacency here. And in respect of public health, for example, in September, the Minister committed to doubling the workforce in public health. I think there was about 254 people working in public health pre-COVID. Government has provided resources to double that number. And also, hiring is already starting in relation to that. And in terms of the consultant status, again, the Quahara report is there. Government is acting on that. There's ongoing discussions between public expenditure and health, but there will be creation of consultant posts. The manner of and the framework through which all of that will happen is an important issue, and there's lots of detail involved in that simply has to be worked out. But the resources are there. Over 4 billion has been put into the health service this year. Record numbers, 2 billion for COVID and 2 billion non-COVID. Quite extensive and quite significant. And in relation to student nurses, it again is not the same as the first phase. It's not the same at all. And when the nursing degree programme was brought in 2002, and I would have brought it in myself as Minister for Health, that was seen as a radical transformation of nurse education at the time, to put student nurses on the same par with other university students in terms of degree and so forth, and the investment in facilities in all our universities and institutes of technology. All of that happened. And there was negotiations and work ongoing between the Minister for Health and the in relation to a variety of issues in terms of trying to support student nurses in the current climate within the hospitals, particularly, for example, in terms of the application of pandemic unemployment payments to student nurses who understandably lose their jobs at weekends that they would have had because of COVID restrictions. That has now been made available to student nurses. But crucially, their clinical placement in fourth year and their internship has to be protected as well from an education perspective. And that is something that is very uppermost in terms of the HSE's objective in this situation.
Taoiseach, there is no doubt the intense hardships that people have suffered and the collective solidarity people have shown have helped stave off the worst disasters in terms of COVID-19. However, there is a gamble that you're taking in rejecting the NEFIT advice, and they're very clear about that in terms of the potential impact of opening the hospitality sector that could lead to the family gatherings that we all know need to happen at Christmas actually being imperilled. That's a serious gamble. But when it comes to something that should be less controversial, the support of our frontline healthcare workers and the resources and so on that they need, you are clearly failing. Because you didn't answer the obvious point. Why are the Public Health Committee, 98% of the public health doctors, threatening industrial action? Why are we in a situation with 1/3 of the recommended level of staffing? How are we going to deliver an immunisation programme with that level of staffing and with the people who we need to deliver it threatening strike action because of the way they are treated? How can you explain that 71% of student nurses and midwives in a survey said they are going to probably leave the country after their training because they feel so badly treated? How do you possibly justify the testers and tracers that we need to keep on top of outbreaks, having no sick bay and having rubbishy hire 'em and fire 'em contracts when they should be treated with respect with decent pay and conditions?
Thank you very much. Taoiseach.
Yeah, again, could I just take issue with the Deputy? The Government hasn't rejected any advice. And you're wrong to assert that in respect of NEFIT. We engaged with NEFIT along with us, and I had obviously discussions myself with the Chief Medical Officer. We took a more conservative stance on the restriction of visitors to households. I think we haven't opened the pubs. That's the point. And sorry, Deputy Murphy's not even in the chamber. It's outrageous what's going on. I'm not answering Deputy Murphy, I'm answering Deputy Boyd Barrett, but there shouldn't be people in corridors heckling in at this stage of leaders' questions. That's not acceptable behaviour, if I could say it through the Chair. And I just want to make the point, it was because of a range of advice from EY and everyone that we didn't open wet pubs, because of tracking what happened in August and September and taking decisions based on that evidence base. And in respect of the point I was about to make, we took a more conservative approach on the household visits, and then traded that off with the hotels and restaurants, which, by the way, has twofold dimension to it. One, there is an issue of mental well-being and people needing to get out of their homes. There's only so much any government can do in a democratic society in terms of imposing severe restrictions on its citizens. And government has to take a measured approach and a balanced approach in relation to that. You can simply not lock up people forever either. So balance is required.
Thank you,
and that's what we took. We didn't reject advice. We took a balanced, measured approach, which is difficult and which is challenging and which we're going to monitor. And we appreciate very much the advice from NEFIT. There was a trade-off. The impact of restrictions on household visits is equivalent to the impact of opening the hospitality sector that we did. Equivalent. So we decided not to go with the household restrictions and to keep it as it is until the 18th in that regard. But it doesn't get away from the fact, if I finally say so, it really is down to personal behaviour. It's down to all personal responsibility from here on in terms of Christmas. And we need to all collectively send that message by our own behaviours and collectively to really work to try and keep this virus at bay. There are no guarantees.